Welcome. Did you know that some medications you take every day might be quietly damaging your memory and overall brain health? Yes, it's true. Imagine that you are trying to solve one health issue, but these very medications might be increasing your risk of cognitive decline. What if you could identify these hidden risks and protect your brain while managing your health conditions? Recent studies have revealed a startling fact. Memory loss is not necessarily an inevitable part of aging, yet certain medications can accelerate cognitive issues if not used properly. So, which medications are the most concerning? Stay with us until the end, because the seventh medication on this list is surprisingly common but extremely risky. Almost nobody knows about it. Let's dive in. The reality of aging and dementia. Myths versus facts. For years, we were led to believe that aging naturally brings cognitive decline and dementia. This belief has been widespread for decades. However, recent advancements in neuroscience have shown that this is not entirely accurate. Memory loss can indeed be prevented or delayed by making specific lifestyle adjustments. According to multiple studies, dementia is not a direct consequence of aging. Rather, it stems from particular changes within the brain. The buildup of beta-amyloid plaques and tau tangles is primarily responsible for diseases like Alzheimer's. So, how can you maintain cognitive health as you age? Diet. A Mediterranean-style diet rich in vegetables, whole grains, and omega-3 fatty acids can improve cognitive function. Exercise. Regular physical activity, even simple activities like walking or swimming, promotes better blood flow to the brain, reducing the risk of dementia. Mental stimulation. Engaging in mental challenges, such as puzzles, learning a new language, or reading, helps preserve memory. Social engagement. Regular social interaction can boost brain function and stave off cognitive decline. Managing chronic conditions. Conditions like diabetes, high blood pressure, and obesity can contribute to memory problems if not managed properly. However, there's more to the story than just lifestyle. Environmental factors such as air pollution and toxin exposure can also impact brain health. Genetic factors might predispose individuals to dementia, but lifestyle choices can modify these risks significantly. Now, let's shift our focus to medications that can harm memory. Proton pump inhibitors, PPIs, a hidden risk to brain health. Proton pump inhibitors, PPIs, like omeprazole, lansoprazole, and pantoprazole, are widely prescribed to treat acid reflux and other gastrointestinal issues. While they are effective in reducing stomach acid production, they have serious side effects when used long-term. Prolonged PPI use has been linked to a higher risk of dementia. A study conducted over 5 years with more than 6,000 participants revealed that 10% of those who used PPIs for over 3 years experienced memory loss. But why do these drugs have this effect? The problem lies in how PPIs reduce the absorption of essential nutrients like vitamin B12. B12 is crucial for nerve health, and its deficiency can result in neurological problems, including memory loss, confusion, and even mood changes. Another lesser-known issue is that PPIs can disrupt the balance of gut bacteria, which is critical for the gut-brain axis, a pathway that plays a significant role in cognitive health. In addition to brain-related issues, PPIs can also lead to kidney damage, bone fractures, and an increased risk of respiratory infections. Therefore, doctors often recommend limiting PPI use to short-term treatment, usually between 2 weeks and 3 months depending on the patient's condition. For those suffering from acid reflux, non-drug alternatives like dietary changes, stress management, and natural supplements might be effective options. Anticholinergic drugs, blocking memory pathways. Anticholinergic medications are commonly prescribed for conditions like Parkinson's disease, bladder problems, and even some respiratory disorders. These drugs block acetylcholine, a neurotransmitter that plays a key role in learning and memory. While they help manage symptoms effectively, they can have unintended consequences for the brain. Studies have found that anticholinergic drugs can increase the risk of dementia by up to 54%, particularly among older adults. This finding comes from a 10-year study conducted at the University of Washington, involving more than 3,500 participants. Notably, the risk escalates with higher doses and longer usage. Medications like scopolamine, oxybutynin, and benztropine are among the most commonly associated with cognitive decline. Even some over-the-counter medications, like diphenhydramine, found in many sleep aids, have anticholinergic properties. These side effects can be severe, including confusion, drowsiness, and long-term memory issues. Patients and doctors should carefully weigh the benefits and risks of using anticholinergic medications, exploring alternatives like physical therapy, dietary adjustments, and safer medications when possible. Corticosteroids, like prednisone and dexamethasone, are frequently prescribed for autoimmune diseases, asthma, and allergies. These medications reduce inflammation effectively, but prolonged use can result in several serious side effects, including cognitive problems. Recent research shows that corticosteroids can cause changes in brain structure, particularly in areas like the hippocampus, which is responsible for memory and learning. One large study in the UK involving over 500,000 participants revealed that those using corticosteroids for long durations had a significantly higher risk of developing dementia and other mental health disorders. Long-term corticosteroid use can also lead to high cortisol levels, a stress hormone that, when elevated, can damage brain cells. For this reason, doctors recommend using the lowest effective dose for the shortest possible period. Non-pharmacological treatments like physical therapy, meditation, and anti-inflammatory diets can often help reduce the need for corticosteroids. Benzodiazepines are commonly prescribed for anxiety, panic disorders, and insomnia. Medications like alprazolam, commonly known as Xanax, and diazepam, or Valium, are widely used due to their calming effects. However, they come with a major drawback: memory impairment and an increased risk of dementia. These drugs can disrupt normal brain function by altering neurotransmitter activity and interfering with the natural sleep cycle, which is essential for memory consolidation. A notable study found that more than 40% of long-term benzodiazepine users experienced memory problems, decreased concentration, and increased sensitivity to sensory stimuli. This is particularly concerning for older adults who are more vulnerable to these effects. In addition to cognitive decline, benzodiazepines can cause physical dependence, making it difficult to discontinue their use without experiencing withdrawal symptoms. Doctors often suggest non-drug treatments like cognitive behavioral therapy, lifestyle changes, and relaxation techniques to manage anxiety and insomnia, reducing the need for prolonged benzodiazepine use. Amphetamines like Adderall and Ritalin are commonly prescribed for attention deficit hyperactivity disorder, or ADHD. While they help improve focus and concentration, prolonged use can have serious side effects, including memory loss and other cognitive issues. These drugs increase dopamine and norepinephrine levels, temporarily enhancing attention and motivation. However, studies have shown that long-term use of amphetamines can alter the brain's natural dopamine pathways, leading to memory problems, decreased motivation, and even emotional instability. Some users report persistent cognitive problems even after stopping the medication. For individuals with ADHD, it's crucial to balance medication use with behavioral therapy, stress management, and lifestyle adjustments to minimize cognitive risks. If you found this information helpful, please like, share, and subscribe for more health tips. See you in the next video.